Make your next move with American Express Business Platinum. Enjoy complimentary access to the American Express Global Lounge Collection. And with a welcome offer of 150,000 points after you spend $20,000 on purchases on the card within your first 3 months of membership, your business can soar to new heights. Terms apply. Learn more at americanexpress.com/business-platinum. Amex Business Platinum. Built for business by American Express.
New Vitamin Water Zero Sugar Pineapple Passion Fruit is packed with vitamins. Just like the amount of peas we packed in that sentence. It's packed like your tote bag. The one you stole from your ex. Or your overpriced half a studio apartment. Or extra rushed rush hour traffic. Packed like your calendar. Triple booked at 5, of course. Grab a vitamin water. Did we mention it's packed with vitamins?
Hello, I'm Midwife Pip, and welcome to the Midwife Pip podcast, the home of expert information and real chats on all things pregnancy, birth, and beyond. This episode is something I am really passionate about, and that is planning for the type of birth that you do not want. The reason this is really important, and to be honest with you, often really overlooked and missed, is because we tend to have a focus on the type of birth we do want and the things we do want to achieve. However, that means if birth or labour takes a twist or turn, we are not then adequately prepared to navigate those adjuncts, those twists or turns, those bumps in the road, and therefore are much more vulnerable to birth trauma. Now, this episode gives you a little sneaky insight into a community clinic workshop that I did with my YPJ members. YPJ stands for Your Pregnancy and Postnatal Journey, and it's my exclusive program where me and my expert team support families from the very moment they fall pregnant right through to the postnatal journey. So if you are currently an expectant mum and feel like this level of support and information might be helpful to you, do get in touch and drop me a DM on Instagram at midwife_pip. Message me saying YPJ and let's have a conversation and see if we might be able to guide you. But for now, I hope you enjoy this conversation and that it gives you a little bit of food for thought as to how you may want to navigate your own birth preparation. As you've hopefully all seen, we're going to be delving into some of your cesarean section questions. One of the other things that you can then look at, which I think really plays into that genital cesarean section, like we just mentioned, is that immediate skin to skin. The other thing that you can do that I think really helps with that transition for breathing and adaptation after a cesarean section is keep babies warm. Another question was, do they give antibiotics before a cesarean section to reduce the risk of infection to baby, and will the antibiotics be passed to baby? How long are you in hospital for, assuming all goes well? Typically about 24 to 48 hours after a cesarean section. Hi guys, good evening. Can everyone hear me all right? Awesome. I will wait to see if a few more people are going to be joining us tonight. And then as you've hopefully all seen, we're going to be delving into some of your cesarean section questions. Has everyone seen that we're talking about that tonight? Yeah, is that good? In your reflections, quite a few questions came up around cesarean section. So I thought, right, let's pull them all together and kind of chat through them all, because sometimes it's just so much easier to talk through things on Zoom than to type them. So that's what we can kind of use tonight to do. So what I've done is those of you that wrote questions either in your reflections or in your hyper support ahead of time, I've kind of pulled them all together. I'll just keep adding people as they join. I've pulled them all together and I'm going to go through them. I've tried to kind of group them into before, during and after cesarean section. But what I will do, if you're happy, I'll ask you to hold all your questions until the end, and then we can dive into any questions that come up off the back, if that's okay, because I suspect some of your questions as we start talking will be the ones that kind of come up as I go through them. But feel free to either, scribble them down, try and remember them in your head if you've still got that
that capacity at 7 o'clock on a Wednesday night in a cold old February, or ping them in the chat box and I'll look through that at the end. I don't mind. But I think that's probably the best way so that we can try and get through as many of these great questions as possible. As always, this will be recorded and uploaded. So if you want to, look at it back later on in pregnancy or however you want to use it, that is absolutely fine. Now, quick sense check, because as far as I'm aware, none of you guys are planning a cesarean section as plan A, are you? But someone shout out and correct me if I'm wrong. It's no one's plan A, is it? No, perfect. Didn't think so. Great. So, but what we'll do is, because we know, and you can ask your local hospital this actually, that cesarean section rates, statistics are very much on the rise nationally, throughout all of the UK. The national average is looking around 30% at the moment. That's made up of planned cesarean sections and unplanned cesarean sections. That does vary hospital to hospital, and it will vary month on month in hospital. So it's always a really good idea, even if you are planning a completely physiological vaginal birth, to think about actually what's your cesarean plan as well. Because if it does crop up, it's really unhelpful if you don't know what you want that to look like. It puts you in a really vulnerable position. And often that's when we see things like birth trauma. So if cesarean section is something that is bottom of your birth preferences list, absolutely fine, but we still want a plan for it. And we still want you to be really educated about it. Now, one of the questions that came up is how to prepare for a cesarean section. And I love this because, yes, we absolutely want to prepare for all birth outcomes. Induction of labour, spontaneous onset, instrumental birth, uncomplicated vaginal birth, epidural birth, instrumental birth, and cesarean section birth. So it's really important when you're looking at your birth preferences that you're not just thinking about that plan A preference, but actually, how do you want to feel when you bring your baby into the world? No matter what the situation is around that birth, I really encourage you all to write down how you want to feel, somewhere between 1 and 3 words, how you want to feel when you bring your baby into the world. And from there, think about what makes you feel that way. So, for example, if you want to feel calm, well, what makes you feel calm? It's going to be different for us all. Is it your partner's aftershave? Is it you're wearing an eye mask so that everything's nice and dim? Is it your favourite music? What are those things? Is it your toddler's little toy? What are those things that make you feel instinctively calm? They're the things to have in your birth, whatever your birth's like. So then think, is this something that I can bring into theatre? The chances are it absolutely is. All the things I've just talked about, yes, of course, we can incorporate all of those in a theatre setting. So when thinking about preparing, it's really, how do you want that to feel? If you are welcoming your baby into the world in theatre and abdominally, how do you want that to feel? And that's part of your cesarean section preparation, because that allows you, in the same way you plan a vaginal birth, that allows you to start planning what you want that cesarean to look and feel like. Another great way of preparing for a cesarean section is to listen to other people's cesarean stories, because they'll have done things or talked about things that will be helpful. You'll see some stuff and you think that won't work for me. Absolutely fine. And you might see other things that you think, oh yeah, I really like that idea. Immediate skin to skin is really important for me. So how can we then talk to your hospital about making that possible? We are starting, and I say starting, to move away from a cesarean section birth being a surgical procedure. Thank goodness. We are starting to recognise it as a birthing experience, which sounds nuts, doesn't it? But I think historically, it's kind of been a case of, if the decision is made for a cesarean section for whatever reason, and we'll go through some of those, that it's kind of like all over to the medical team and that's it. But really, we're starting to see a shift in that, which is good. It's a really good thing because it doesn't need to be that way. So actually, we can start thinking about what things are important to you. Is it immediate skin-to-skin contact, which is a great one to start facilitating? Now, some hospitals, they are a bit few and far between, if I'm honest, at the moment, will do this as routine at a cesarean section. A lot of people still don't. But if your baby is completely well, there is no reason why you can't have immediate skin-to-skin if that's what you want to have. And even with an emergency cesarean section, most babies, the vast majority, are born in good condition. And they can be assessed initially on you. All your team need to do is use an extra sterile drape so that the surgeon can place baby onto a sterile drape and your midwife can then help you to put them on you. The barrier is protecting the sterile field, which of course is important, but it's very easy to overcome. So it's having these kind of conversations, actually, what's important to you, and then how can we make sure that happens? And these are things to be writing down in your birth plans. These are things that you can be sending to Chloe and I in your third trimester, definitely by 36 weeks. So we can help you if you're like, this thing's really important to me. It's really important, that we, capture a picture when our baby's born or whatever that is for you as an individual. How can we make that work if this happens? And we can help to support you and guide you, and you can have those conversations with your team to make sure those things are in place. You'll notice on birth stories, so those of you that have already got access to your birth journey, birth stories are all on there. Those of you that haven't yet, you can still find them in the Facebook group if you just search hashtag birth stories. And you'll notice that we've got some of our wonderful YPJ members that have shared really positive cesarean section birth stories in there. Also, our own lovely Chloe has had 2 cesarean section births. So she's always happy to talk through things with anyone that wants to sort of talk to someone that's had a cesarean section birth experience themselves. So you've got good, robust support for kind of looking at how you can prepare for that. Another one that's come up kind of linked to that is what a gentle cesarean section, and is it always possible? Now, a gentle cesarean section can look like a few different things depending on where you pick up that term. In the kind of, I suppose, most extreme sense, the idea is with a gentle cesarean section that once baby is, once your abdomen's kind of opened, that baby crawls out of the womb into the world rather than an obstetrician helping to move them out of the womb. Now, we tend to only really consider this in planned cesarean sections. And that, to be honest, is because if you're doing an unplanned or an emergency cesarean section, the chances are you're doing that because there is some concern over mum or baby. And the team have decided with your consent that actually the safest and best option is to get baby into the world a bit quicker. So often we don't want to delay it. We want to get them into the world, and therefore that assistance to get them out is usually kind of in the best interest on that risk balance kind of health benefit scales. However, sometimes at a planned cesarean section where there is no rush, there is no concerns about baby, some babies that are being born head first may start to make some crawling movements into the world. Not always. So it's one of those things that it's really difficult if people have really set preferences on this and it feels almost disappointing, or it becomes a bit of a negative relationship between women and obstetrician. But actually, sometimes it just isn't possible. They just don't. They just don't. See, we can't wait for hours. It's kind of like give it a couple of minutes and see whether they do anything, and then we can gently support that. So it's something that you can have as a kind of preference or a can we see if, but knowing that actually if they don't make those crawling motions, then someone does need to support them into the world. And that's always done as gently as possible. One of the other things that you can then look at, which I think really plays into that gentle cesarean section, like we just mentioned, is that immediate skin to skin, because I know that's so important for so many mums when they're first born. And we know it has incredible benefits for mums and babies. We know that for babies, having immediate skin to skin with mums can actually stimulate breathing. It can help to regulate their heart rate. It can regulate their temperature. and it supports bonding and breastfeeding. It can be really, really powerful. So we know that we can facilitate that in a cesarean section when babies are born well and in good condition. And actually, I was part of a team that published some research prior to COVID called Delivery Room Cuddles. And what we did was we managed severely preterm babies having skin to skin with their parents. And the outcomes were incredible, really powerful. Babies respirating so much better actually on their mums, even really poorly, tiny, tiny babies, than when they were removed from their mums. So it really is possible. The other things that sometimes come up with a gentle cesarean section, which are so possible, is environment. So in the same way we think about our birth environment in any other space, things like lighting, things like music, things like scents, who you want present, these can happen in theatre. Your surgeon has a bright operating light on your abdomen that is always on. The room lights around them are insignificant. They're not what they're using to operate. So if lighting is really triggering to you, if the bright lights of theatre feel really difficult, actually you can totally ask for those to be dimmed. And lots of hospitals are doing this now more and more. So we're in a really exciting time actually when it comes to preparing for cesarean birth, because we can start to have these conversations that just didn't happen, 5 years ago, for example. You can, if that isn't possible for whatever reason, or if, you do just meet a difficult character, that's when having an eye mask can be really nice. And your birth partner can provide that, have it in their pocket ready for you when you go into that theatre setting. You can even spray it with some, lavender or whatever your favourite fragrance is. So it creates that nice relaxing control for you. And then obviously whip it off when your baby's born so that you can see them. But really thinking about, gentle cesarean section, thinking about that environment, really think about what environment are you looking to create? And then how can you kind of pick that up and move it wherever you may go for birth? And what adaptations might you need to make? And how can you and your birth partner communicate those? It's all very, very possible. And those small things, that immediate skin to skin with your baby, that favourite piece of music playing, can make a really, really big difference, I promise you. So don't underestimate these little things and how that can make your birth feel. Another one that came up was, what questions should I ask before a cesarean section? And this one is going to be really individual as to the reason for your cesarean section and the circumstances surrounding it. But I think one of the things that is really nice is to have the discussions we've just talked about. So you may, for all of you guys that are here live, that this wasn't your plan A if it does crop up. And so just being really honest, you're hopefully at that point on board with it and you've gone through the reasons why, and just saying this wasn't my plan, but these are a few things that are really important to me. Can we facilitate these still? And just having that conversation. And often you'll be really surprised at how they're like, oh, yeah, actually, yeah, we can just get an extra sterile drape so that you can have that really important skin to skin contact. Simple things. I promise you're not asking anyone to move mountains. These are all really simple things, very easily done, can absolutely be done and make a big difference to you. Never feel like because you're asking for something extra or more that you're being like difficult or awkward. You're really not. This is your birth. We might only do this 1, 2, 3 times in our life. It's really important it feels right to you. Some of the other questions, the brain tool. You'll all have heard of the brain tool by now. And if you are new to IPJ and you haven't yet, I promise you'll hear of the brain tool. Benefits, risks, alternatives, intuition, nothing. With cesarean section, we can also throw on an E, brain E, which is emergency. So sometimes in an emergency, we almost have to fast track the brain tool. However, I caveat that because even in an emergency cesarean section, there is always time for communication. Even if someone is talking to you and popping some stockings on for you or helping you get into a gown or taking some bloods, there is always time for a question. So if there is something, even in an emergency, that you're like, actually, I don't understand this, or I need to get this across, please never feel like you need to be silent. Even if you talk to someone that's proactively doing something, there is always a few minutes. And then using that brain tool so that if you are having a cesarean section, it has been mentioned or recommended that you also understand why, you're clear on your options, and that you have confidence in that being the right decision for you and your baby at that time. And if you're not sure, if there is some doubt, then knowing you can communicate that. Again, it's not you being difficult, it's a massive decision. So feeling confident that you can say, can you just explain X, Y, and Z? Can I just ask why we can't do X and Y? It's absolutely fine to ask these questions. Never go into a big decision in labour and birth like a cesarean section without having complete confidence and clarity that it's the right decision for you. When we make these decisions and we have that control, it's honestly really transformative. So always knowing you can hit pause, even if it's 30 seconds, to have those kind of conversations. Risks of cesarean section was another one that came up. Again, it's going to be individual depending on the circumstances around you and your baby and the reason for the cesarean section. Generally speaking, a cesarean section is surgery. So it carries the same risks as any other surgical procedure. So things like infection, things like bleeding, that we know are higher complication risk with cesarean section than vaginal birth when that goes fairly straightforward. Other complications can be things like when you have your cesarean section. So if you're having your cesarean section in the final stages of labour, when your baby is very low in the birth canal, but they can't be birthed by forceps, for example, we know that surgically this can be more complicated. Sometimes it means that baby's head needs to be lifted back up into the abdomen a little bit higher if they're too low. And it can increase the risk of damage to surrounding structures, so things like your bladder and your bowel. We also know that cesarean sections done in the final stages of labour when the cervix is fully dilated do carry an increased risk of preterm birth in a subsequent pregnancy. Relative risks are always really low with these things, but we know that there is an increased risk. We also know if you do have a cesarean section, that the chances of your placenta in a future pregnancy attaching low or across the cervix is increased. And these we call them abnormally invasive placentas that we are now nationally seeing an increase in. They used to be like needle in a haystack cases, but actually now are becoming much, much more regular. And we've got people in specialist posts now to deal with them because there is that demand with the higher cesarean section rates nationally. These are at much higher increased risk of things like bleeding and hysterectomy. So we have to always make this decision not lightly. You know, it is, any surgery carries risk and it's a big decision. And that's why it's so important that you can use that brain tool, that you can hit pause, and that you can really make that informed choice when it comes to cesarean section. That sounds scary when we talk about risk, doesn't it? But I want to really reiterate that a cesarean section birth can be a super positive and a super empowering birth for you and your baby. But we have to be honest in that risk balance, it does carry some of those extra risks. They are always going to be unique to you. There'll be circumstances where a cesarean section on that balance is much lower risk than going for a vaginal birth. And that's where using the brain tool can really help you kind of navigate that. A great question is, in what circumstances should changing to a cesarean section during labour be considered? So this can be for a variety of reasons, but typically we can separate it into two. Risks for mum, risks for baby. So often we focus so much on baby in labour, but mums are really important too. You're really crucial to your baby doing all right. We really need you to be doing well for your baby to be doing well in labour. So if there is a concern over mum, sometimes that's infection, sometimes that's bleeding, sometimes that's progress of labour. If there's concern for baby, and often that's changed in their heart rate trace, it may well be position of baby. If there are concerns about either of those things, that's when discussion of cesarean section kind of comes to play. Now, one of the big ones that we often hear about is progress in labour. And this is the one that if everybody's well, if mum's well, if baby's well, I always encourage us just to hit pause and think, why? Why is progress in labour not going as expected? Is it really slow progress? Because we know examinations just give us a snapshot. And if it is, why is it? And if we can identify a reason, so often, and I know I talk about it all the time, it's the position of the baby. If we can identify at that point, it's the position of the baby. Well, let's do something about it. There's so much we can do about that in labour. So this is where being able to unpick and think, actually, why are we going for this? And can we do something about that thing? You know, can we do something about that thing? Can we buy a bit more time if that's something that you don't want to have at that point? And that can be really, really powerful, because if we can rectify the reason why, then we can sometimes, quite often, then avoid that cesarean section. It's never black and white. So often we think it's either carry on exactly as we are in labour or have a cesarean section, and it's just not. And that's why I love the A of the brain tool, because what are the alternatives? There is this big old grey area that sometimes it's really powerful to just pause and reflect on. Now, clearly, this is a lot easier to be done if we've got that okay mum and okay baby. If there's concerns over mum or concerns over baby, then often the chances are that weight is going to be much more in favour of cesarean section. But it's just about you being able to unpick and have real clarity kind of on those reasons. Another question was, do they give antibiotics before a cesarean section to reduce the risk of infection to baby? And will the antibiotics be passed to baby? It's a yes to both. So with a cesarean section, because we know that's that increased risk of infection, mum has a dose of antibiotics through a cannula, so through a little a tube in a vein, usually in your hand, in theatre. So you have one dose of antibiotics, just one. If everything else has been fine, just one dose of antibiotics to help reduce the risk of infection for mum. Now, the time between mum having the antibiotics and baby being born at that stage is minuscule. So how much of that antibiotic gets through to baby, we just don't know, but it's unlikely to be a really significant amount. Types of incision and how it's closed back up. And does this make any difference to recovery? So a cesarean section goes through 7 layers of various tissues, some muscle, some fat, some fascia, some skin, all the kind of different layers that goes through. Now, typically, especially if there's concern over mum or baby, the surgeon will cut through those layers quite quickly and then afterwards take their leisurely time putting them all back together. So it's all lovely and neat. The fast bit of a cesarean section is getting baby here. That's done really quite quickly, depending on the reason, anywhere between sort of 5 and 30 minutes in general. The bit afterwards can take all the time in the world. If everything's well, you know, there's no kind of rush. Everything slows down a little bit if everybody is doing good. The incision is typically about 30 centimetres long, just below your bikini line. There are some instances where this may be done in different places, but that really is a rarity. And that's something that you would have counselling beforehand. I know that for all of you guys, that's not the case for any of you. So it's typically below your bikini line and about 30 centimetres in length. Super discreet. Mums are always amazed over time how neat and how much that scar fades. And for all of you guys, your scars will be even more optimized because in postnatal recovery, we have scar massage and we do some scar work as well with you. My brand new book, Midwife Pip's Guide to a Positive Birth, is now available. So much more than a book, this is a guide that allows me to hold your hand through your birth preparation journey. With over a decade of experience and knowledge packed in, to ensure you really are empowered in the way you deserve to achieve a positive birth regardless of the twists and turns that crop up. Make sure that you get your hands on Midwife Pip's Guide to a Positive Birth book now and are empowered to have the birth experience that you deserve. So you pick that up later on. So in terms of where it is, that's where it is. And in terms of layers, it's those 7 layers. Now, for most women, dissolvable stitches are used. For some women, especially women with a larger body mass index, or if you have allergies to any of the sutures that are used, which is a rarity, then sometimes staples are used and they do need to be removed, or a different type of suture that needs removing. But for the vast majority, it is just dissolvable stitches that go over that cesarean section. And then you have a very basic looking kind of wound dressing that goes on that. And usually the following day that comes off and we just air dry. We used to leave it on for 5 to 7 days, but actually it increased risk of infection. So now it comes off and air dries. If you are someone that has an increased risk of infection or you do have a larger BMI, then sometimes different types of dressing are recommended because it can be quite a sweaty area. And we know that moisture and sweat can increase that risk of wound infection. So a good tip is if your scar does sort of sit in a little bit of an overhang postnatally, is to try and get air to that area each day. So sometimes just lying on your bed, elevating the kind of skin or tissue above that scar and letting it get a nice bit of air to it. Keeping it clean and dry, just water. I'm against lotions and potions on wound care postnatally. Keeping it clean and dry is all we need to do. And one of the best ways of improving scar recovery, postnatal recovery with wounds is reducing the risk of infection. And you've got Abby's brilliant live that she did about wound care under your pelvic health module as well, which is a really good listen in those kind of final weeks of pregnancy. How much can you see during birth? It's kind of up to you, to be honest. So if you're a bit squeamish, you don't have to see anything. If you do want to look, then some partners will have a little peek with permission kind of over the drape. So if you are the mum having a cesarean section, you're led quite flat. You have an anaesthetic doctor kind of at your shoulder and your midwife nearby to you. In front of you, you have a big sterile drape. So that's kind of all you see is a blue sheet. And then the surgeons are sort of the other side of that sheet with your midwife. So you don't see anything, any blood, any insides of your abdomen, you don't have to see anything. There's a lovely sterile drape there. And that's why in that little bubble, if you have got like your favourite music playing, you have your partner by your side, you can create that nice little Zen moment. What lots of parents request or like is at the point of their baby being born for that drape to be dropped. So that baby comes up, drape goes down and you can see your baby. That's at the point where if they're well, you can have another sterile drape put over you that the surgeon can lower baby onto. They do need to have a decent length cord. If their cord is super, super short, then it isn't possible. One of the things we still really like to do at cesarean sections is delayed cord clamping for at least 1 minute. I always talk about at least a minute. Sometimes we can do more, but at least a minute. A minute is when we get the maximal benefit of blood transfer to baby. After that time, the benefits are still there, but they're just not quite as significant. So we have to weigh up, does baby need checking over? Is mum bleeding? Because remember, all the time that baby's out, you've got an open wound that could be bleeding. So then it's a bit of a kind of risk benefit, but at least 1 minute of delayed cord clamping. Another good question. How common are breathing problems for a baby with a C-section and how is that managed? Now, this depends on primarily 2 things. Timing of cesarean section. Now, there's a reason why for the majority of planned cesarean sections, unless there's a medical reason to do it beforehand, the majority are timed at 39 weeks. And that's because we know that when babies don't go through the process of contractions and labour, they can struggle a little bit more to start with regulating their breathing. And that can sometimes mean an admission to the neonatal unit for a short period of time to support them with that. Not always, but some do. We know that that risk is less after 39 weeks, which is why typically planned cesarean sections are done at that point to balance baby being born versus risk of breathing complications. And that's because babies' lungs are full of fluid. Through the process of labour, some of that fluid there's like pressure and that fluid is reabsorbed. When they're born by cesarean section without labour, that process doesn't happen. So they have got a lot more fluid that still needs to be shifted for them to properly aerate their lungs and transition to life on the outside world. Babies born by cesarean section with labour have some of that process happen. So often, unless there's some other issue with their breathing, they tend to not have what we call TTN, that difficulty with breathing afterwards. The other thing that you can do that I think really helps with that transition for breathing and adaptation after a cesarean section is keep babies warm. Sounds so simple. The amount of times I walk into theatre and I'm like, can you keep the baby warm? Theatres are cold. They tend to be much colder than the room that you birthed your baby in. And if we then separate mum and baby for routine checks that we don't need to be doing, we can still have a golden hour, can still have a golden hour in theatre. We take away you and dad or the other parent as their heat source. So keep babies warm in theatre. They're likely to need an extra layer than they will in the room. They need a hat on in theatre. So thinking about skin to skin, nice warm babies is really important. And fed babies. Babies that are warm, babies that are fed can keep their blood sugars up. Babies can't concentrate on all these new survival things at the same time. We need to help them out a little bit. Have I answered that question? So in terms of how common they are, I can't give a number because it really depends on when they're born and why they're born. But hopefully that outlines kind of why that might happen. How long is the recovery process? Likely to be slightly longer than an uncomplicated vaginal birth because it's surgery. We have to respect your body's gone through major abdominal surgery. Now, if we had any other surgical procedure to our body, let's say you had surgery on your knee, which nowadays is likely to be keyhole, you would still expect to have 6 weeks off work, not drive for 6 weeks. You'd probably be resting. You'd probably be sleeping, eating and drinking really well because you know your body's got to recover. The trouble when we have a cesarean section, which is not keyhole surgery, it is major abdominal surgery, is we go home with a baby. So we don't sleep very well. We have a complete hormonal roller coaster. Society's expectations of new mums are wild. We're not eating and drinking as well as we might do normally. So we don't help our recovery. We can't make babies sleep better in the immediate postpartum. But what we can do is rest. Really important to rest. We can make sure we're avoiding infection as much as possible with good wound care. We can make sure we're avoiding constipation with diet and hydration. And we want to supercharge protein intake postpartum, especially with a cesarean section. Your body has got to recover. We want lots more protein in our diet. In terms of recovery timelines, I never give a set deadline and set timeline with recovery. There are too many curveballs. There are too many individual circumstances. But one of the things that we are awesome at in YPJ is guiding that postnatal recovery. You have a whole dedicated postnatal recovery program to follow. You have the team in your pockets. Recovery is different for everybody. There are so many curveballs. There'll be a week where sleep's thrown off and you don't want to do anything other than survive. So we pause recovery. It's always a upward trajectory, but it's just not a straight line. It's up and down. That's exactly how it should be. Otherwise, it is just too much unhealthy pressure. After your initial recovery period in YPJ, we then have a one-to-one call with everybody to align goals, to align expectations, and to allow you to have completely bespoke postnatal programming. So please know that however you birth, cesarean section doesn't mean massive setback. If you have got goals, sports that are important to you, etc., they are all still very achievable. It may look a bit different, but equally there are so many curveballs that can make that look a bit different. Can I still cut the cord? Yes. Yes. However, because when baby's first born, they are in the sterile field, so that initial cut is going to be done by the surgeons. After that, though, it can be cut again. So they typically leave it very irritatingly long. And it needs trimming. So often the surgeon will do that first cut and then mum, or often it's birth partner, will then kind of trim or cut the cord again afterwards. How soon will they ask you to move around after a C-section? Now, I am actually a really big advocate for women moving as soon as possible after a cesarean section. We're not talking about going marching flights and flights of stairs, but we know that one of the other risks of cesarean section is blood clots because it's surgery and you're postpartum. So you already have 2 risk factors. So you lying in bed is only going to increase that risk. We want to get mums up and gently mobilizing as soon as possible. Typically, depending on the circumstances, somewhere around 8 to 12 hours after a cesarean section. What our kind of limiting factor is, if you like, is your mobility, because you will have had some form of spinal anesthetic or epidural so that you're comfortable. So we need to make sure that you can wait there. And that kind of duration is typically around 8 hours to when women can be safely mobile, but it will vary between individuals because we all respond to medication differently. You will have a catheter in your bladder for that initial period as well, because all the time that you're numb, you're not going to be able to go to the toilet. And what we don't want to do is stretch your bladder and cause potentially a bladder injury. So you have a catheter in your bladder, usually for around 12 to 24 hours. So we want to make sure that you can safely mobilize and that you've got sensation and that you're drinking well before that catheter then comes out. From a pelvic health standpoint, I'm in a rush to get people moving, but I'm not in a massive rush to get catheters out. I really like to make sure that mums are stable on their feet and are drinking enough that they're going to have a wee. Otherwise, we cause complications of having to put catheters back in, and it's all a bit of an avoidable faff quite often. So making sure you've got that normal sensation, you're able to get up, you're able to wee, and that it's not 1 a.m. and you're really dehydrated because you haven't drunk for 6 hours. In that case, sometimes leaving a catheter in until the morning when you've had some breakfast and a big old cup of tea is actually much more beneficial. And the last question on the ones that came in before was, how long are you in hospital for, assuming all goes well? Typically about 24 to 48 hours after a cesarean section, depending on how everything went. For some mums and babies, that will be longer if you need additional care. But if we're talking about you had a very straightforward cesarean section, feeding's going fine, you've got up, you're moving, your pain's under management, you're able to wee, you've opened your bowels, everything's great, then around 24 to 48 hours. I'm always an advocate of please try not to rush home after you've had your baby. It's so tempting. Everyone wants to get back in their own bed. Postnatal wards are busy, they're noisy, you're tired, you just want to get home to your creature comforts. But I promise you there's nothing more irritating than going home and having to go back in. So if your pain isn't under control, if your bladder's a bit iffy, If you need more support with feeding, then sometimes an extra 12 hours makes a big difference and prevents you coming back in. But typically, sort of 24 to 48 hours. That was all the questions that you guys sent me on Hyper Support ahead of tonight's call. Had anyone got anything that kind of came up off the back of that, or anything else you want to ask that I haven't covered, or anything that I said that didn't quite make sense, or you want more kind of clarity or information on? Shout out, pop it in the chat box, whatever you want. Oh, Katie's here. Oh, Katie, great question. Do they go into the same scar for the second section or create a new one? So what they do, Katie, if you've had a previous cesarean section, is cut out the old scar. So you only have one. So the scar on the skin, they will cut out and then go through the old scar tissue to get to baby. So often, and everyone heals differently. So the amount of scar tissue when you've had a previous cesarean section varies drastically, but it can mean it takes a little bit longer to get to baby because scar tissue often is a bit more difficult to get through than non-scarred tissue. But it really does depend on each individual as to how much scar tissue there is there. And we don't know how much there is there until we go and look. And that's why, 2 cesarean sections is typically considered really safe, but 3 cesarean sections, 4 cesarean sections, the risks do start to increase because we don't know how everything's healed. Sometimes bladders kind of start to adhere to structures, so we increase risk of bladder damage. And that's why when Katie Price talks about her, like, I don't know, how many cesarean sections she had, like 14 or something, she goes on about it. And then women come into me and say, but it's fine because Katie Price has had loads of cesarean sections. I do have to cringe a little bit. The injection you have after a cesarean section to prevent blood clots you never had. What are the risk factors that include women in that category? Yes. So Katie, you didn't have it because your cesarean section would have been classed as a planned cesarean. So that as its own only risk factor doesn't trigger the injections. The injections are somewhere between a 5 to 10 day course, or for those of you that have had blood thinning injections in pregnancy, up to 6-week course of blood thinning injections to reduce that risk of blood clots, because we know that a surgical procedure does increase that risk. Now, if you've had an emergency or an unplanned cesarean, you automatically get them. If you've had a planned cesarean section, but you have another risk factor for blood clots, so sometimes that's family history, sometimes that's age, sometimes that's BMI, can be all sorts of things, then you might trigger for them. So it's very much a how many boxes do you tick, what's your score, as to whether you get them or not. And then extra risk for a second, Katie. So as I mentioned, that scarring, so we don't know where it is, how significant it is, but typically 2 cesarean sections, it would be very unlucky if there was excessive complication from it. If it is more complicated surgically, then there's an increased risk of bleeding, always. The more complicated any surgery, the higher the risk of bleeding. But typically, 2 cesarean sections, we don't kind of bat an eyelid. We're quite happy. Does that answer everything, Katie?
Yes, thank you.
No problem. Gina, not necessarily cesarean section related, but for what reason are blood clots most likely postpartum? Hormones. Good old hormones, Gina. And the fact that women are often less mobile. So being pregnant is a big risk factor for blood clots because of hormones. Postnatally, they don't just disappear, sadly, and often we're then more sedentary. So they're the kind of reasons. And that's why hydration and mobilization postpartum are so important. Amy, where does your partner sit? Your husband's very squeamish and a fainter, and you're the opposite. I love it. So often this way. It's the reason why women give birth. Sorry to any men and dad listening. So if you imagine you're sat, you have a screen you have an anaesthetist kind of somewhere here behind you, your partner's just by your shoulder and they are sat down. We don't ever have birth partners stand up in theatre. We've had too many faint. And he doesn't have to see anything either. So he's just sat by your shoulder. You're in your own little bubble, if you like, because you've got this drape. So you are kind of in your own little bubble. So yeah, he doesn't have to clap. What's the pain medication used for cesarean section and what are the risks of that? Yeah, great question, Helen. So if you're having a planned cesarean section, it's a spinal anaesthetic. So our A game is always to have mums awake for cesarean birth because we want you to meet your baby. So A game, if it's a planned cesarean section, is a spinal anaesthetic. Now that is one injection in your spine that numbs everything from just under your breasts down to your toes. So you should be completely numb. You shouldn't ever feel pain during a cesarean section. You will feel sensation, so some tugging, some rummaging. Sometimes mums will say it feels a little bit like a washing machine in their tummy. So some sensations, but you shouldn't feel pain. If you feel pain, it's always important that you let the team know so they can do something about it. If you've been in labour and you've had an epidural in labour, then you can have the epidural topped up. So if the epidural has been working really well, your epidural typically numbs you from around your umbilicus, your belly button, to your ankles. So the anaesthetist can top it up with some stronger solution so that it brings the block and that numb level up to under your breastbone. And then they test it. The really clever thing about epidurals and spinal anaesthetic is your nerves in your body that block pain also block cold. So it's a classic little trick where they will test how well your spinal anaesthetic or epidural top-up is working by using ice cubes on your tummy. And when you don't feel cold, we know you won't feel pain. So that's how they check. Now, if you've been in labour without an epidural, again, it would be a spinal anaesthetic. If we tried to top up your epidural and that level didn't come up, or you were feeling cold from ice in an area you wouldn't expect, you can still have a spinal anaesthetic. So some women find that their epidural in labour is never incredible. It might be helpful, but there's still sort of spots of contractions that you feel on and off. Then they would just abandon the epidural and do a spinal to make sure you're comfortable. If during the procedure you do feel pain, then there is the option to convert to a general anaesthetic where you go off to sleep to make sure that you're not in pain during it. It's unlikely that that has to happen, but it is always there as a backup. Likewise, if for some rare reason you cannot get a spinal anaesthetic to work, then again, general anaesthetic is a backup. But we really, really try to avoid it at all costs. Touching on that, if you do have to have a general anaesthetic for your caesarean section, your birth partner can't stay in theatre. So when your baby is born, they are labelled and taken straight to your birth partner in your birthing room. So they can have skin to skin if that's what you wanted for your baby. And then as soon as you're awake, which is typically around 60 minutes, you're reunited with them. But that's always a bit of a barrier. And that's why we really do try to make that an absolute last resort. And it's not super commonplace, but it does sometimes happen. So it's just worth thinking, what do you want that to look like? For myself, for example, I had a little emergency bag for my husband. I think he just thought I was being nuts. But I obviously see these things. So I had a little bag for my husband with like first outfit and blanket. He knew he was going to have skin to skin and some syringes of colostrum. So I thought, if worst case and I'm asleep, I wanted our baby to have skin to skin, which he could do, and he could give some colostrum because that was going to be our feeding preference. So I knew that if that couldn't be me, he had like, you know, the next best thing until we're reunited. And then remember that you can have a later golden hour. So it's not a case of, well, that's it, you've missed it. delegate the initial golden hour, and then you have yours when you're reunited. So knowing that that is still possible later on, the same as if babies are taken to a special care or a NICU unit straight away. When you're reunited, start your golden hour then. And we will always, I promise you, always try and keep mums and babies together as much as possible to really minimize that separation. And it is a rarity that you will be separated, but I think it's important that we talk about it when we're talking about this kind of thing. Jen, is there any point during being transferred from the room you started labouring into theatre when you'd be separated from your birth partner? Great question, Jen. We used to. Now, this is something that, again, we're seeing change a lot. I'm not too sure why. Anaesthetists used to really like to leave birth partners in rooms. And I think it's because when you're trying to concentrate on getting an anaesthetic in and creating a sterile field, you want as minimal interruption as possible, which I totally get and makes sense. But actually, in today's world, we're getting much better. And certainly in my trust, it's now commonplace that birth partners stay with mum. They're actually really useful because they can help reassure you, they can help keep you still and in greater position for the anaesthetic as well. So the vast majority now, Jen, we keep you together, but it is a conversation that you can have. And if it's something that makes you feel really anxious or really uncomfortable, let them know. Because there's, as I say, there's always this kind of grey area. There's lots of things that sometimes happen just because they happen, and it's for absolutely no good reason. And if someone says, actually, I'm not comfortable with that, you suddenly find the team go, all right, we won't do it then. They've just been doing it because they've been doing it. No one likes change. And it's not that they're bad people. We just get in a habit. We all do that at home, don't we? Like we just do things around the house because we do it. And actually, until we stop and think, why have I just done that? Or why didn't I do that? We don't kind of think twice. So these are things having those birth preferences. These are those things. If you know that having your birth partner with you that whole time makes you feel calm, great. These are the things that are important to get down. Are you less likely to have a C-section if you've previously had a vaginal birth? Gina, yes. Yes. So if you've previously had a vaginal birth, even with the assistance of forceps or 1-2s, typically you are less likely to have a cesarean section. The statistics between first-time mums labouring and mums who've had one previous cesarean section for a non-repeatable risk factor are pretty similar in terms of likelihood. Any other questions, guys? We've covered lots, haven't we? We've covered loads, which is great. Has everything I've said made sense? I'm conscious that all of you guys that have come on don't want a cesarean section. And so sometimes when we talk about things that you don't particularly want, it can feel a bit triggering or it can make you feel a little bit anxious. So is anything that I've mentioned triggered any kind of worry or anxiety in anyone's mind? Because it's always this, I guess, a bit of a fine line between prepare but not scare. But also, I'll always be totally honest with you guys. I'm never going to, sugarcoat things or just paint like a rosy picture because that's not helpful in your preparation. If you do... oh, sorry.
Sorry, Pip. Am I allowed to come in?
Please do. Please do.
I was just going to say, I think I'd mentioned before that I'm like quite nervous at the prospect of a C-section. But I think like knowing my condition now and talk of blood clots and blood loss kind of instills that fear a little further. And I like think that it's probably something that I'm going to need to work on in the next 12 weeks. Just in case, because I never thought, this is really, really morbid. I apologize, everybody. I never thought about like maternal mortality statistics when I was during my first birth. Didn't even give it a second thought. But kind of now thinking about hemorrhaging and things like that and the effect that being on blood thinners would have makes me like a little bit more nervous going into it this time, I think.
Yeah, I totally. Also, Gina, I think that just generally comes up more second time. I just think when you've got that added responsibility of another child at home, I think just in every aspect of life, I think you consider things a little bit differently. What I would say, Gina, is the relative risk of significant hemorrhage is still so low. And obstetric teams, your team, are so brilliant at managing excessive blood loss. It's phenomenal. It's honestly phenomenal. And the other thing is, knowing you are at higher risk means there will be things that are done slightly differently for you to reduce that risk even further. So there are, things that we might look at. So if you started to have even a little bit more blood loss than was completely normal, for someone who had no risk factors, it might be watch and wait. For you, you could have medication straight away to help reduce that risk of bleeding. So they're going to be even more on it. And those risks are honestly so, so small. Of course, they always exist in the same way that, we walk down the road and roads can be dangerous, right? But actually, the overall relative risk is still very, very small.
Thank you. That does help.
But I do think that kind of almost pressure of I've got to be well through this birth is more when you've got another child at home. I think that's a real common theme that we definitely see. Katie, please do, lovely. Please do drop us a message in Hypersupport. Roseanne's question: when does the first postpartum period arrive when dropping breastfeeding or pumping? Do you have to stop completely, or can it arrive when you're still? Do you know what? It's so individual. Some mums will be exclusively breastfeeding and have a period at 4 weeks. Others, they won't have one until a year after they stop. It is really, really variable. There's such a wide time frame for those postnatal periods. It is, some women have no impact on their menstruation with breastfeeding, whereas others, it completely suppresses it. So it is a bit of a wait and see how your body responds to that change, unfortunately. And usually it's emotions that start making us think, maybe there is a postnatal period coming. Laura, do you want to ping us a message in Hypersupport as well? And Amy, do you still bleed? Oh, this is a good question, Amy. Do you still bleed after a C-section like you do when you have a vaginal birth? Yes, it's exactly the same. So the bleeding is from the placenta detaching from your womb, so from the uterus. So if you imagine you've got your uterus and the placenta adhered, when the placenta peels away, it leaves lots of little vessels. So your uterus has to clamp down to stop those vessels bleeding. So whether you've birthed your baby by cesarean section or vaginally, the bleeding is actually coming from the same place. Hopefully that makes sense. Amazing, guys. It's been so good to be able to kind of delve into this topic. And I am conscious it's an emotive topic, but I also think it's really important that when there is something that triggers us or we're fearful of or we're worried about, that we don't bury it. I think it's really important that we can lift the lid on it and unpick it and talk about it, because we know that suppressing it and burying it doesn't help. And then if one of these things that we don't particularly want to happen does crop up, it kind of bites us on the bum a bit. So I'm conscious that, you might tonight have some anxious thoughts or feelings or something that you want to talk about a little bit more. Just lean on us. Message us on Hypersupport, and we can unpick things with you a bit more in a one-to-one if you want or need. But I'm really pleased you've managed to kind of get through so many questions, and thank you to those that sent in questions and are happy to share the fact that actually it can be scary, and that's okay. That's why we're planning for it. That's why we're talking about it, so that you don't feel like it's this big scary unknown anymore. You can have confidence that if someone says, okay, think you need a cesarean section, you can be like, right, let's talk about that. I know what that's going to look like. I know what I want, and I know how I'm going to have control over that situation. And that's the place that we're going to get you all to. So thank you for joining me. And as I say, anything that crops up, any thoughts, feelings, anxious thoughts, I know a couple of you have said you're going to drop a message in hyper support. Please do. That's what we're here for, to kind of help you navigate through these kind of more difficult topics. Sometimes the easier topics are, great and easy to talk about, but these ones are equally really, really important. I'll let you enjoy the rest of your Wednesday evening, and I will speak to you all very soon. If you have listened to this birth story, enjoyed it, and feel that you are ready to really embrace and dedicate yourself to having the most informed, supported, and empowered journey, and want to see if we may be able to support you in YPJ, your pregnancy and postnatal journey, please drop me a Instagram DM at midwife_pip, or get in touch on my email, pip@midwifepip.com, and let's chat through things and see if we might be a good match for each other. I hope you've enjoyed listening, and wishing you all the best on your journey through pregnancy, birth, and beyond.